And we're going to get started, of course, with health, because as we know, when it comes to our health, that is one of the key reasons for people having a positive well-being survey. So Patrick Charmel, he is the President CEO of Griffin Health Systems. Welcome. Recently, Griffin Health and the Naugatuck Valley Health District approved the Community Health Improvement Plan, or what we refer to as the CHIP, which is based on community conversations and a lot of the data that is represented not only in this report, but other reports, of course, in the health field. The plan calls to focus on 3 key areas: heart disease, behavioral health, which does include substance abuse, and maternal and prenatal health. Patrick, we've heard you speak on the importance of a proactive approach to wellness and overall well-being versus just being reactive, and when you get sick, go to the doctors. In fact, you've used a little infographic that I took from you and put in our little executive summary that kind of looks like a gingerbread man, which identifies that there are quite a few contributing influencers on our health. Can you share with our audience what are some of the key social determinants of health that you see here in the Valley? And you can stand too, because I know sometimes you like to walk.
I'll stay seated.
Okay.
I might go on too much. Well, good morning, and thanks for the opportunity. Thanks for the collaboration to conduct this community health needs assessment. So in terms of that infographic, I actually stole that from someone else. The attorneys in the room, if you just keep violating a copyright, I think it just becomes part of the public domain, and so we don't have to worry about it. So we need one more person to publish it, and I think we're fine. But what that infographic says, and it's something that we've been talking about in the community, and you're going to hear from other members of the panel, is that the traditional focus on healthcare is been looking at health from the sick care perspective and believing that the way to increase health is to provide more traditional care. So as I've talked over the last couple of weeks, our approach in the healthcare delivery system in the US, which actually has put us at a disadvantage because we underperform other countries, is we basically wait for folks to get sick. And then we apply the various resources that we have. And that sick care focus is not terribly effective, frankly, because we're treating the symptoms of an underlying problem. And we're not treating the symptoms of the underlying problem. We're actually, let me say that again. We are treating the symptoms. We are not treating the underlying problem. And I think when we talk about the CHIP priority areas, we can really see that. So again, if we wait for people to get sick, and unfortunately they get really sick, they show up at the hospital, they use the emergency department, they get hospitalized, that's the most expensive venue in our whole system. There's a much more effective way and a much more efficient way to improve health. First of all, we have to look at a broader definition of health. And understand, and that's where the infographic comes in, what really impacts health. It's not the traditional medical care that we're most familiar with, which kind of I represent. It's all of the things that lead to ill health, and we're broadening our understanding of that. So you heard Sharon talk about household income across the community. Well, we know that half the households in Ansonia and Derby don't earn enough income to meet their basic needs, and I'm sure David will talk about that. Well, if they can't meet their basic needs, they can't afford quality housing, so we have to look at whether the environment that they're living in is leading to ill health. If that's the case, can they access care, that traditional medical care? We know that many of them don't have adequate transportation. We know that some of those households can't afford nutritious food, and that's leading to ill health, all right? And when they do get sick and access the medical care system, we tend to try and treat them oftentimes with medication, and they can't afford their medication. So again, we can say, well, the way to solve some of the problems that have been identified in the survey, whether it's heart disease or diabetes, is just to apply more medical care. But again, we're treating the symptoms. We're not getting at the underlying problem. So when we talk about the CHIP priority areas, we're looking at heart disease. Well, what are the underlying causes of heart disease? Poor nutrition, a sedentary lifestyle. But just to tell people you need to eat more nutritious food and not recognize the fact that they can't afford it and don't have access to it is really not being effective in addressing the problem. So I think the discussion that we've been having, and we call it this period of enlightenment we've all gone through over the last year or two, is to appreciate the fact that sort of traditional medical care certainly has a role. And we can get better at that, and we strive to get better at that. But if we're going to be effective at improving the overall health of this community, we need to look at those underlying causes, and we need to look at the social factors that are leading to those underlying causes. Now that becomes really daunting. You know, the folks that have been in the traditional business that I've been in, it's hard enough to deliver safe, quality care and make it accessible to as many people as possible. But to say you're now responsible for the underlying social causes of ill health once you understand them, you realize that you can't do that alone. That's where it really does take a village. And you know, I really thank the foundation for being the convener and sort of raising the level of understanding in the community about how important that is. And then the idea of, if we're going to recognize that we have to be focused. We cannot boil the ocean, all right? Or we can't boil the Housatonic River, all right? We actually have to focus on just a small number of factors and say, if we can address those successfully, the effect, the broad effect of that is going to be enormous. So Sharon, thank you, and hopefully together we can sort of extend this understanding and really begin to focus through these collaborations that are forming. And there's a reason why I'm sitting next to David on this panel. All right, and you'll hear more about that. Thank you.
Now, when you still have that microphone. So when I found it very interesting that dental health makes an effect on the heart.
Yes.
That there are a lot of people, because people don't go to the dentist, and I don't quite understand it, and if you can address that, I don't know, but, right? So what are some of the things in the three focused areas of your CHIP? What type of work do you hope that the hospital, as well as other health organizations, other health service organizations, will be doing over the next 3 years to help address this?
So yes, there is a connection between oral health and heart disease, and it has to do with bacteria that sort of are harbored in the gums and the mouth. You know, I'm not a physician. I don't play one on TV, so I don't want to go too much further. But things like oral health are also not only tied to adequate preventive dental health care, but also to nutrition. They all come back to the same issues. So if folks are not getting poor nutrition, they have poor oral health, and leads to other disease like heart disease. The two focus areas in terms of the CHIP that I think we can talk about this morning is maternal and infant health. And the focus of the needs assessment and some of the work we're planning to do looks at the fact that women in this community are accessing prenatal care late in their pregnancy, and sometimes not at all. It's not uncommon for us to have women present to our childbirth center who have had no prenatal care at all, putting both the mother and the child at tremendous risk. And that's something that we all have to take responsibility for. The care is out there, but we have to understand the social sort of impediments that are preventing women from accessing that care. The Medicaid program covers women during pregnancy who are low income, but obviously it's not just that. We employ obstetricians as part of our faculty practice, and we treat women regardless of their ability to pay. So it's not just an economic issue. There are other causes that we need to identify if we're hoping to improve access to prenatal care and adequate prenatal care again, because we're talking about the health of the mother and the infant. So I think that's an area where we really need to look at those underlying social issues that are preventing the delivery of care that we're very capable of providing. Mm-hmm. And this has been a long-standing issue in the community. I think when I first arrived, early in my career, I helped to create the childbirth center at Griffin Hospital, and it was one of the issues that we heard a lot about. People used to describe it as infant mortality. Well, we don't necessarily have an infant mortality problem, thank God, but we do have this situation where women aren't accessing care early enough in their pregnancy, and we've got to get at that. Now, in terms of heart disease, we need to look at a couple of factors that are very prevalent in the community. The rates of smoking in this community are still high, despite tremendous efforts from a lot of people in this room to reduce the rate of smoking. And smoking leads to heart disease. A sedentary lifestyle leads to heart disease. Unfortunately, this report says that the rate of obesity amongst adults in this community has grown from the last time we did the needs assessment to this time. Now, it's not that we didn't know that obesity leads to a whole series of chronic conditions, but the rate is actually going up. By the way, it's going up nationally as well. Mm-hmm. So are we willing to confront that? I just saw Beth Comfort walk in. I mean, there's been a community-wide initiative starting in the schools. So maybe we're affecting the next generation. We actually started doing nutrition education and obesity prevention in the schools, thinking children would be agents in their household. They would learn this in school and go home and shame their parents. It's working, but clearly not enough. And then the whole idea of physical activity. And I see Jack Walsh in the back. You talk about the Greenway and looking at how walkable this community is and where there's opportunity for recreation that doesn't cost the people the gym membership that we know many households can't afford. Those are the kinds of things I think we need to look at. Yes, we can provide medical care for folks who have heart disease, and I think that continues to improve, but it's the underlying causes that I think we just need to focus on, and we need to do that collectively.
Thank you, Patrick. And those of you that are with us from the corporate community, so many nonprofits are in this room, but it's the corporate community where we could really all use your help, because our citizens of the Valley, and as well as all the other people that are working for you in your organizations, it's the same principle as Patrick said. It's not just the Valley, it's nationwide. We have these different problems. And so think about doing different things in your offices. Can you get standing desks, or those options to have sitting standing desks? Are you encouraging people to go to the gym, or encouraging people to take a walk at lunch? Because some of the things that Patrick was saying is not just those sedentary pieces, it's also the stress level. We know that stress is really killing a lot of people when it comes to having challenges. So thank you, Patrick.